Cancer is the leading cause of death for women worldwide and will continue to rise unabated unless action is taken to prevent it, warns the American Cancer Society. The UN missions of Malawi and the Commonwealth of the Bahamas co-hosted a special side event at UN headquarters on Wednesday, advocating to help women fight against non-communicable diseases by raising public awareness and calling on governments and partners to improve access and quality of health care throughout the world. Breast cancer is the leading cause of death in the Caribbean, with cervical cancer following at a close second. And breast cancer is often appearing in women 10 to 15 years earlier in developing countries as compared to developed countries, warned Calista Mutharika, First Lady of Malawi and incoming Vice Chairperson of the Forum of African First Ladies Against Breast and Cervical Cancer.
The main challenges are lack of education amongst the women of our countries, lack of resources, for example, health facilities for screening, and the actual infrastructure is not there. But also, the people of Africa, most of the women, don't have the knowledge, so they lack information because of lack of education. And another major challenge is the fact that the resources are not there. If only the resources were there, then we would be able to address, the education of the women, the information, make sure that information is accessible, make sure that there is infrastructure, make sure that the personnel, the medical personnel are there. But with lack of all these facilities, it becomes a huge challenge.
But the world has long heard the fight against women's breast cancer, yet little is known about the drastic number of women dying from cervical cancer. 53,000 women die in Africa each year, and over 80,000 new cases appear each year in the continent, according to the World Health Organization. In fact, non-communicable diseases, namely cancers, are the world's #1 killer, causing 60% of all deaths in our world, and both breast and cervical cancer disproportionately affect women, especially in low and medium income countries.
All women have a fundamental human right to the best attainable health, and to fulfill that right requires that adequate attention and resources are given to cervical and breast cancer. Secondly, that investing in health, and especially investing in women's sexual and reproductive health, should be seen as what it really is. It is an investment. It's an investment in human capital that pays itself back many times in increased productivity, and it puts communities and nations on a track of social and economic development by unleashing the full potential of girls and women.
My key message is early detection is key. Do your test, early detection. If you catch it early, you can deal with it. Also self-examination and pray. Prayer works every time.
The Progress in Cervical Cancer Prevention Report Card was also launched on Wednesday, revealing that by 2030, cervical cancer is expected to kill over 474,000 women per year, and over 95% of these deaths are expected to be in low and middle income countries. Both breast and cervical cancers, along with other CDC deaths, are largely preventable when the disease is detected at an early stage. Panel experts called for greater political will and collaboration with health organizations toward a strategy of implementation on national, regional, and local levels in order to improve the health and lives of women and girls worldwide. The United Nations will hold a high-level meeting on the control and prevention of non-communicable diseases to be held at UN headquarters from September 19th through the 20th. Afaf Kanja for South News, United Nations.